Ibuprofen 200 milligram tablets, also compared to Motrin 200 milligram tablets and Advil 200 milligram tablets. How ibuprofen works. Ibuprofen is a non-steroidal anti-inflammatory medication that works by stopping the body's production of a substance called prostaglandins that cause fever, pain, and inflammation. Once you take ibuprofen, it takes about 30 minutes to see an effect. Ibuprofen is indicated for adults and children greater than 12 years old. You can take ibuprofen for fevers. You would take 1 to 2 tablets by mouth every 4 to 6 hours as needed. For headaches, you can take 1 to 2 tablets by mouth every 4 to 6 hours as needed. For migraines, you can take 2 tablets by mouth once a day for 10 days. For pain, you can take 1 to 2 tablets by mouth every 4 to 6 hours as needed. For osteoarthritis, you can take up to 1,200 to 3,200 milligrams per day in 3 to 4 divided doses for less than 10 days. And then menstrual pain, you can take 2 tablets by mouth every 4 hours as needed for less than or equal to 10 days. Adverse effects of ibuprofen: abdominal pain, stomach bleeding, rash, dizziness, headache, heartburn, nausea, and hemorrhage. Exclusions to self-care. You should not take ibuprofen if you have kidney disease or a history of stomach bleeding. Do not use ibuprofen if you have an allergy to other NSAIDs, such as naproxen or other ibuprofen products, an allergy to aspirin, stomach bleeding, a stomach ulcer, if you're currently taking a blood thinner, if you're taking another NSAID, or if you're having greater than or equal to 3 alcoholic drinks per day. If you are taking ibuprofen, you should stop the use and ask your doctor if your symptoms get worse, if you have a history of stomach bleeding, if new symptoms develop, if you get red and swollen skin, if you continue to experience pain after 10 days, or if you continue to experience a fever after 3 days. Several drug interactions seen with ibuprofen are: if you're taking a blood thinner, it can increase the risk of bleeding. If you're taking aspirin, it can increase the risk of bleeding. If you're taking an antidepressant, it can increase the risk of bleeding. If you're taking cyclosporin, methotrexate, and lithium, and ibuprofen, it can lead to kidney toxicity. And if you're taking a blood pressure medication and also an NSAID, such as ibuprofen, it can increase the blood pressure. Some special instructions while taking ibuprofen are to take it with food or milk to minimize gastrointestinal irritation, and it may cause severe stomach bleeding. When should you not take ibuprofen? You should not take ibuprofen if you're pregnant or if you're lactating.